Have you ever wondered why we have nightmares? There's a certain mystery that surrounds these terrifying nocturnal experiences, a sort of enigma that has puzzled human minds for centuries. Nightmares, those vivid, unsettling dreams that jolt you from your sleep, leaving your heart pounding and your sheets soaked in sweat, are a universal experience that cross all boundaries of age, gender, and culture. Though they are most commonly associated with the innocence of childhood or the pressures of stress, the reality is that nightmares are not discriminative. They can invade the sleep of the calmest individual and transform the sanctuary of dreams into a haunting playground of fear and anxiety. It's intriguing, isn't it? How our own minds can conjure up such frightening scenarios while we are in the vulnerable state of sleep. And yet, despite the commonality of nightmares, there's a plethora of misconceptions surrounding them. Some believe that nightmares are a punishment for our wrongdoings or a prediction of the future. Some even regard them as a visitation from malevolent spirits. But these are just myths, born from the human instinct to find explanations for the inexplicable. In reality, nightmares are a complex interplay of our psychological state, our physical health, and our brain's activity during the dream stage of sleep cycle, known as REM sleep. But why does this interplay result in nightmares? What triggers these unsettling dreams that can leave us shaken and disturbed? The answers lie deep within the realms of scientific research, where neurologists, psychologists, and sleep experts are continuously unearthing fascinating insights into the world of nightmares. Their findings are not only shedding light on the causes of nightmares, but also offering effective strategies to cope with them. Intrigued? Let's dive into the world of nightmares and explore the latest scientific research. Get ready to unravel the mystery of nightmares, and perhaps, in doing so, you might find ways to make your nights peaceful again. Ever thought what triggers these terrifying dreams? Well, let's delve into the science behind nightmares. The brain is a complex organ, and it doesn't take a break even when we're asleep. In fact, it's during sleep that the brain undergoes numerous processes, one of which is dreaming. This brings us to the stage of sleep called REM, or rapid eye movement. This is the phase where most dreaming occurs, including those spine-chilling nightmares. It's called rapid eye movement because your eyes move quickly in different directions, despite them being closed, and your brain activities are at their peak, almost similar to when you're awake. Now you might wonder, why would our brain produce nightmares during this stage? Well, scientists believe that dreams, including nightmares, are a way for our brain to process emotions. But why the scary ones? Recent scientific studies suggest that nightmares are linked to our psychological state. Stress and trauma, for instance, can significantly impact the quality of our dreams. When we're stressed or have experienced a traumatic event, our brain works overtime to process these emotions, often resulting in nightmares. It's kind of like our brain's way of saying, hey, we've got some unresolved issues here. Furthermore, research has shown that nightmares can also be a symptom of certain mental health conditions, such as anxiety and post-traumatic stress disorder. These conditions can cause an overactivity in the parts of the brain responsible for fear and survival instincts, which can manifest as nightmares during sleep. In essence, nightmares are not just random scary dreams. They are intricate products of our brain's emotional processing system, particularly during stressful or traumatic times. They allow our brain to confront and manage the emotions that we may not be addressing when we're awake. So, nightmares may be a natural response of our brain to stress and trauma, but there's more to it. Stick around as we delve into the psychological perspective and explore how nightmares can affect our physical health. Did you know that your nightmares could be telling you something about your psychological state? This may sound a bit outlandish, but let's delve into it. The world of psychology has long been fascinated with the realm of dreams, and nightmares are no exception. Two notable figures who have explored this domain are Sigmund Freud and Carl Jung. Freud, the father of psychoanalysis, believed that nightmares are a reflection of unresolved conflicts or unfulfilled wishes from our waking life. He theorized that these unresolved issues find their way into our dreams, often in distorted or symbolic forms, thus leading to nightmares. On the other hand, Carl Jung, a Swiss psychiatrist and psychoanalyst, proposed a different perspective. He suggested that nightmares are a way of our subconscious mind communicating with our conscious self. According to Jung, nightmares can be a reflection of our deep-seated fears, anxieties, or unresolved issues. They are a mirror of our subconscious mind, depicting aspects of ourselves that we might be ignoring or suppressing in our conscious life. This doesn't mean that every nightmare is an indication of a deep psychological issue. Sometimes a scary movie before bed or a late-night snack can also trigger a nightmare. However, recurrent nightmares, especially ones with common themes, might be indicative of underlying anxieties or concerns. For example, a recurring nightmare about being chased might be reflective of an individual feeling threatened or overwhelmed in their waking life. Similarly, dreams about falling could symbolize a fear of losing control or feeling unsupported. So, the next time you wake up from a nightmare, instead of trying to shake it off, take a moment to reflect on it. It might not be a mere coincidence or random occurrence. Your subconscious might be trying to send you a message, alerting you to something that needs your attention. In essence, nightmares could be a gateway to understanding our subconscious mind and the issues that we might be grappling with. So next time you have a nightmare, it might be worth considering what your subconscious is trying to tell you. Could your nightmares be a sign of an underlying health issue? This question might seem unnerving, but it's a crucial one to ask. Nightmares are more than just unsettling dreams. They can also be indicators of certain health issues. Let's delve into this connection. In the realm of sleep disorders, nightmares often dance hand in hand with conditions like sleep apnea, a condition where breathing repeatedly stops and starts during sleep. It's been observed that the terrifying episodes of nightmares can coincide with the moments when a person stops breathing. Similarly, insomnia, a disorder characterized by trouble falling or staying asleep, can also be a breeding ground for nightmares due to the disrupted sleep patterns. Nightmares can also be signposts pointing towards mental health problems. Conditions like anxiety and depression often carry the burden of nightmares in their symptom list. Picture this. Your mind is a theater, and when it's clouded with anxiety or depression, it tends to play out distressing narratives in the form of nightmares. Post-traumatic stress disorder, or PTSD, is another condition where nightmares are a common occurrence as the mind replays traumatic events in a loop, turning rest into unrest. Certain medications can also trigger nightmares. Antidepressants, blood pressure medications, and drugs for Parkinson's disease are just a few examples. These medications can alter the chemical balance in your brain, leading to vivid and often disturbing dreams. So, what should you do if nightmares are becoming a regular visitor in your sleep? The answer is simple. Seek medical advice. If your nightmares are frequent or causing distress, it's important to talk to a health professional. They can help determine if these nightmares are a symptom of an underlying condition that needs attention. Nightmares are not just about the boogeyman under your bed or the ghost in your closet. They could be your body's way of signaling an internal imbalance or disorder, so don't dismiss them as mere figments of your imagination. Remember, regular nightmares are not something to ignore. They could be your body's silent alarm bell, cautioning you to pay attention to your physical and mental health. So listen to them. After all, your health is your wealth. So what can you do if you're plagued by nightmares? Firstly, maintaining a regular sleep schedule can be incredibly helpful. Our bodies thrive on routine. Going to bed and waking up at the same time each day can help regulate our internal clocks, which in turn can lessen the frequency of nightmares. Additionally, practicing good sleep hygiene is crucial. This involves creating a sleep-friendly environment. Consider the temperature of your room. A cooler room often promotes better sleep. Limit your exposure to bright screens before bed, as the light can trick your brain into thinking it's still daytime. Also, try to keep your bedroom a place for sleep and relaxation only, not work or other activities. Nutrition and lifestyle habits can also play a role. Limiting caffeine and alcohol intake, especially close to bedtime, can improve your sleep quality and potentially reduce nightmares. Regular physical activity can also promote better sleep. However, try to avoid strenuous exercise close to bedtime, as it can actually make it harder to fall asleep. But what if you've tried all these tips and you're still experiencing regular, distressing nightmares? It may be time to seek professional help. Therapists can provide techniques such as imagery rehearsal therapy, where you visualize the nightmare and rewrite its ending, or cognitive behavioral therapy, which can help you manage the stress that might be contributing to your nightmares. In severe cases, medication may be recommended by a healthcare professional. This is usually a last resort, used when nightmares significantly disrupt sleep and daily life, and when therapy alone isn't enough. Remember, everyone has nightmares from time to time. It's a common part of the human experience. But if your nightmares are causing you significant distress, it's important to reach out to a professional. There's no need to suffer in silence. Having nightmares can be distressing, but with the right approach, it's possible to manage them effectively. Sweet dreams!